Hello everyone, I'm Dr. Shabahat. I'm consultant cardiologist, nowadays working as assistant professor of cardiology. Today again we'll be discussing another important topic with you guys. What is heart failure? What could be the possibilities? How it happened? Or what could be the symptoms? How it will present? And how can you understand that you could be having heart failure? And I'll tell you what would be the possible non-invasive investigation, which is very important to label it and to further plan for further investigations as well. Okay, so first of all, I would like to request you guys that kindly like my video, kindly share it with your family and friends, because purpose of making my these videos is to educate people and try to make them understand different health related issues in simple language. Okay, and you will be finding a very good website with similar name, where you can find various doctors, you can find various health related videos, different health related articles, news, medicine, even, like it is very good website, and it will be launched soon in this month. So another request would be, like kindly subscribe my channel and kindly click on bell icon, because so that you can find various videos on various health related topics. Okay, so what is heart failure? When we label heart failure, heart failure is when your heart's ability is decreased to pump blood in your body. Okay, so we divide majorly into two categories. Like first of all, like if your ejection fraction is low, like your pumping power is low or decreased due to many reasons. I'll discuss that afterwards. So that could be the possibility, or then we'll say that you are having heart failure when your pumping power is decreased to pump blood in your body, and you'll start to have symptoms of heart failure. So in bookish terminology, it will be heart failure because of low ejection fraction. Okay, ejection fraction usually is measured on echocardiography, which is ultrasound of your heart. Okay, so again, many times this is missed in echo reports. That another thing which is very important in labeling you as heart failure is that if your heart's relaxing power is decreased, like your heart is unable to relax properly, and it will be not properly filled to pump that blood into your body. So in that scenario, again, you may have heart failure symptoms, and we call it as heart failure with preserved ejection fraction, that your pumping power is normal but your relaxing power or diastolic power is decreased. So that is again heart failure, no doubt, with preserved ejection fraction, but your diastolic or relaxing thing has been decreased. So again, you will be having heart failure symptoms. So what could be the major reasons that you are having heart failure? If you are having recent myocardial infarction, major or minor, one of the main reason you are having heart failure is that. Another important reason for if you are having heart failure is any arrhythmia leading to damage to your heart could be the possibility of heart failure. Uh, any tachyarrhythmias, any bradyarrhythmias, any irregularity in your heart rate would be the reason leading towards heart failure. Okay. And another important thing that could be a causative factor in your heart failure is that if you are having any kind of valvular pathology, as valves are those things, like it acts like a window or door in between your various chambers of your heart. It should not be narrowed, it should not be in a leakage position, because blood should not be having any kind of hurdle and push towards from one part of your heart to another. And it should not be in that scenario that whenever it is pumped into another part of your heart, it should not be moved back. Okay, so these are main pathologies or main causative factor or leading towards heart failure. So what could be the symptoms you'll be facing when you are having heart failure? These are like, if you are having shortness of breath or difficulty in breathing, especially if it's coming in like couple of days or weeks, or if you are having a previous history of heart disease, and if you are having difficulty in breathing, or I must say any shortness of breath in several months, it could be leading towards a clue that you are going through heart failure. Okay, so after shortness of breath, if you are having tiredness, fatigue, or any sudden development of increase in your body weight, especially I must say that if you are having any swelling or edema in your body, especially in your lower limbs, in your legs and at ankle joints, or at back or lower back area, it could be the possibility, or it could be due to heart failure. Okay, so I hope you will like my this video. And at last, what is the most important thing that you should be having in that scenario is echocardiography. So echocardiography is ultrasound of your heart, and it will give a very very good overview that what's your heart status now, that what's the pumping power, what's the diastolic power, how is the walls of your heart, any structural abnormality, any valvular pathology or any valvular abnormality, it all will be handled or uh, reviewed in your echocardiography. Okay, so whenever you are having any kind of these symptoms or any kind of these things, don't ignore this. Kindly straight away go to your nearest doctor, or especially I would like to say that book your appointment to a good cardiologist so that they can do your clinical examination. After that, they will go with basic investigations, ECG and echocardiography, and if they'll find anything abnormal, and they will plan further investigations so that it can be treated timely, because time is a game in heart. And so that they can prevent any permanent damage or any irreversible damage to your heart. Okay, I hope you will like my video. Take care. Bye bye.